specialty dealing with ocular and orbital diseases, pretty much anything relating to the eyes and immediate surrounding structures. Ophtho is unique in that it isn't a strictly medical or surgical field, but rather a blend. The practice of ophthalmology can be categorized into three main areas: medical, procedural, and surgical. There are many diseases that are unique to the eye, but also several systemic diseases that have manifestations in the eye. Within the medical focus of ophthalmology, there are five main categories. First, infectious. Infectious diseases of the eye can be viral, bacterial, fungal, or parasitic in nature. These include STIs like syphilis, chlamydia, and gonorrhea, to fungi like Candida, or parasites like toxoplasmosis, or the worm causing river blindness, Onchocercera volvulus. These infections may be confined to the eye, but may also be systemic yet manifest in the eye. For example, with syphilis, a patient may only recognize the ocular symptoms such that the ophthalmologist is the first person to diagnose the patient with a systemic infection. Next, systemic inflammatory diseases can cause uveitis or inflammation of the eye. These diseases are wide and varied, from rheumatoid arthritis and lupus to inflammatory bowel disease and sarcoidosis. Diabetic retinopathy occurs in patients with poorly controlled diabetes. In short, the small vessels get damaged, which we call microvascular damage, resulting in scarring, bleeding, retinal detachments, and can even cause blindness. This is the leading cause of vision loss worldwide. Believe it or not, you can get tumors in your eye. This can be retinoblastoma, which is screened for in newborns, choroidal melanoma, which is actually not directly related to skin cancer, or primary intraocular lymphoma. The eye and orbit are a common site of metastases for other cancers, meaning a primary cancer releases cells in the bloodstream that can take hold in the eye. It makes sense, as the eye has the highest rate of blood flow per weight compared to any other tissue in the body. Prescription and recreational drugs can both cause long-term damage to the eyes. For example, chronic alcoholism may result in vitamin deficiency, leading to vision issues. Alternatively, methanol should never be ingested as it causes optic nerve delamination, which can result in blindness. Glaucoma has two main types: acute angle closure and primary open angle. Both can lead to damage to the optic nerve and irreversible vision loss. Open angle glaucoma is the leading cause of irreversible blindness worldwide, and it's called the silent thief, as it slowly causes vision loss over time without patients even being aware. Ophthalmology has a variety of procedures, which one wouldn't necessarily consider surgical, as these are performed in the office, not the operating room. The way lasers are used in the field is almost science fiction. A laser retinopexy is essentially spot welding to prevent retinal detachment. This is used to treat retinal tears. For acute angle closure glaucoma, which is highly urgent as it can cause rapid vision loss, a laser peripheral iridotomy is used to create a hole in the iris and reduce pressure. Eye injections are also performed, such as anti-VEGF for treatment of diabetic retinopathy and macular degeneration. In a similar vein, a diagnostic tap and inject is where the ophthalmologist gets fluid from the eye and then injects antibiotics or antivirals through the same needle. Lastly, ophthalmologists sometimes perform lesion removal and excision, like when I got my chalazion removed. When it comes to surgical procedures in the operating room, ophthalmologists can perform either extraocular or periocular cases, meaning those that are outside and around the eye, or intraocular surgeries, meaning within the eye. Orbital surgery includes excision, debulking, or taking biopsies of masses and lesions in the orbit. Reconstructive surgery around the eye can be done after trauma, like a baseball to the orbit, or after extensive surgery, such as after a cancer resection. Restorative or cosmetic surgeries include eyelid surgery for ptosis, meaning droopy eyelids, or having excess skin over the eye. Strabismus surgery is concerned with the actual eye muscles to help bring the eyes into proper alignment.